Whether it's a cracked tooth or just plain old bad breath, we've got answers to some of your mouth-related questions. And here to help us out is cosmetic dentist, our friend, Dr. Bill Dorfman. Welcome.
Thank you, Jared.
So, we've got a question from one of our viewers on Instagram. It reads, my teeth look fine, but if I looked at my teeth with a certain light, I see that they're cracked. What would cause these cracks, and are my teeth going to end up breaking and falling apart?
All right, so here's the deal. They're not cracked. What you're seeing are called crazed lines. And they're superficial, they're very, very, very harmless. They're not gonna hurt you at all. And they're usually caused just by use and abuse. As a kid, if you hit your teeth or you traumatize them, you'll get these crazed lines. Or as an adult, if you're eating on hard things like ice or biting a pen or even, biting a pencil or even chewing your nails, you're gonna get these crazed lines. The thing about it, you have to remember, they're harmless. If they deepen and they actually become cracks, they're not harmless. And then you have to have them taken care of. But just a crazed line, I've never had a patient in over 30 years of practicing that's cracked or lost a tooth from a crazed line. And if you don't know the difference, ask your dentist.
All right, next we got a Facebook question from Emily, and she says, sometimes my 23-month-old daughter has bad breath. She brushes her teeth with a natural toothpaste, but at her age, whenever we put toothpaste on, she sucks it off and wants more. Is there anything I can do?
Okay, first of all, the chances of the bad breath emanating from the teeth on a little kid is probably 0, unless they have a lot of cavities. So just look in their mouth. More likely, there are other things. Number one, mouth breathing. When you open your mouth and your mouth dries out, there's a proliferation of bacteria that can cause bad breath, chronic sinusitis, and then GERD, acid reflux. So if you have a toddler with bad breath, take them to the doctor and figure out what it is.
You make such a great point when it comes to kids and bad breath. You have to think about certain ear, nose, and throat problems that can lead to mouth bleeding, enlarged adenoids, tonsils, sinusitis, like you said.
I'll tell you one of the worst things. They lodge stuff in their nose.
That'll get, that creates quite an odor.
Horrible.
That's about the word.
So really, if your kid has bad breath, take them to the doctor because that's just not normal.
And when should a kid see the dentist for the first time?
As soon as they get a tooth.
Okay, that's pretty early.
You only need one, right?
You only need one.
Gotta take care of that one tooth. Okay. We have another question from Instagram that reads, why are my teeth breaking and falling out after I've had my kids? Am I going to have no teeth by the time I'm 30? I guess this, both of you, I mean.
All right, here's the thing. There's absolutely no medical correlation between pregnancy and losing your teeth. There is a condition called pregnancy gingivitis.
Yes.
And what happens is because of the huge fluctuation in your hormones, you can get bleeding gums, puffy gums, actually like painful gums. So if you have pregnancy gingivitis, what I suggest you do is stop the 6-month recall and go to a 2 to 3 month recall. But as soon as you have the baby, and stop breastfeeding, that'll go away.
And then the pregnancy gingivitis typically peaks in the 3rd trimester. And something that you can do when you have irritation is you can take, a cup of water, warm water, and you can mix in a teaspoon of salt. And sometimes that'll help with the irritation a lot. But that does not replace a dentist visit. So for sure, make sure you're following up with your dentist appropriately. Pregnancy is not a valid reason not to see your dentist. If your dentist needs to do something, then they will contact your OB-GYN, and we will make sure that we work together so that we're taking care of you and your baby safely.
Dr. Dorfman, I knew you'd have the answers, and you came through.
Thank
As
you,
always,
Drew.
thank you very much.